Good afternoon, everyone. Today's topic is Introduction to Nursing Research and Evidence-Based Practice. I think you have heard the word of nursing research. The word research means to search again and to examine carefully. Research is a diligent, systematic inquiry or study that validates and refines existing knowledge and develops new knowledge. The ultimate goal of research is the development of an empirical body of knowledge. Defining nursing research requires determining the relevant knowledge needed by nurses. Research is essential to develop and refine knowledge that nurses can use to improve clinical practice and promote quality outcomes. Nursing research is also needed to generate knowledge about nursing education, administration, healthcare services, characteristics of nurses, and nursing rules. Research is needed to provide high quality learning experiences for nursing students and to improve the quality, safety, and cost effectiveness of healthcare delivery. In summary, nursing research is a scientific process that validates and refines existing knowledge and generates new knowledge that directly and indirectly influences nursing practice. Nursing research is the key to building an evidence-based practice for nursing. We're going to talk about evidence-based practice called EBP. EBP evolves from the integration of the best research evidence with clinical expertise and patient needs and values. The best research evidence is the empirical knowledge generated from the synthesis of quality study findings to address a practice problem. Clinical expertise here is the knowledge and skills of healthcare professional who is providing care. The clinical expertise of the nurse depends on his or her years of clinical experience, current knowledge of the research, and clinical literature and educational preparation. EBP also incorporate the needs and values of patient. The patient needs might focus on health promotion, illness prevention. In addition, patient brings values or unique preferences, expectation, and cultural belief to the clinical encounter. Okay, as you can see the left picture, the combination of evidence-based practice, clinical expertise, and patient needs and values goes to evidence-based practice. Some researchers describe the intersection of best research evidence, clinical expertise, and patients' values is evidence-based practice. Findings from a single study are not enough evidence for evidence-based practice. Research evidence for multiple studies are synthesized to develop guidelines, standards, protocol, algorithms, or policies. There are several examples for best research evidence. The first example is the evidence-based guideline for management of high blood pressure in adults called JNC-8. The second one is the American Heart Association guideline for cardiopulmonary resuscitation and emergency cardiovascular care. The last one is the European Society of Cardiology guidelines for diagnosis and treatment of acute and chronic heart failure. Okay, let us explore the EBP example for African American women with high blood pressure. In this example, the best research evidence is classification of blood pressure and education and lifestyle modification and cardiovascular risk factors based on the American Society of Hypertension and JNC 7's guideline for management of high blood pressure. These guidelines are translated by registered nurse and nursing student to meet the needs and values of African American women with high blood pressure. The quality outcome of evidence-based practice in this example is women with a blood pressure less than 140 over 90 millimeter Hg or referral for medication treatment. Let's move on the purpose of the research for implementing in evidence-based nursing research. The first purpose of the research is description, which involves identifying and understanding the nature of nursing phenomena and the relationships among them. Through the research, nurses are able to describe what exists in nursing practice, discover new information, promote understanding of situations, and classify information for use in the discipline. Research focuses on description include identification of the incidence and spread of infection in healthcare agencies, identification of the cluster of symptoms for particular disease, description of the responses of individuals to a variety of health conditions in aging, description of the health promotion and illness prevention strategies used by a variety of populations, and determination of the incidence of disease locally, nationally, and internationally. For example, Lucy et al. Conducted the study older adult perspective of strength in their daily lives. In this study, description for nurse is to encourage physical, mental, and social activities to assist older adults in staying strong. The second purpose of the research is explanation. Explanation clarifies the relationship among phenomena and identifies possible reasons why certain events occur. Research focuses on explanation include determination of assessment data that needs to be gathered to address a patient health need, the link of assessment data to a diagnosis, the link of causative risk factors or causes to illness, morbidity, and mortality, determination of the relationships among health risk, health behaviors, and health status, and determination of links among demographic characteristics, disease status, psychosocial factors, and patient responses to treatment. For example, Monolovich et al. Conducted an outcome study to examine the links or relationships between a nurse dose, including nurse characteristics and staffing, and adverse patient outcomes. The nurse characteristics examined were education, experience, and skills mix. The staffing variables included full-time employees, registered nurse to patient ratio, and RN hour per patient day. Finally, the adverse outcomes examined were MRSA infection and reported patient fall. The research found that nurse characteristics and staffing variables were significantly correlated with MRSA infection and patient fall. The next purpose is prediction. Through prediction, one can estimate the probability of a specific outcome in a given situation. Research focuses on prediction include prediction of the risk of a disease or injury in different populations, prediction of behaviors that promote health and prevent illness, and prevention of a healthcare required based on a patient needs or values. For example, Lee et al. Conducted a quantitative study to examine the factors that were perceived by critical care nurses to predict the risk of musculoskeletal injury from work. The researcher found that greater physical workload, greater job strain, more frequently patient handling tasks, and lack of a lifting team or devices were predictive of the nurse's perception of the risk of injury. The variables identified in predictive studies require additional research to ensure that their manipulation and control result in quality outcomes for patients, healthcare professionals, and healthcare agencies. The last purpose of the research is control. Control is the ability to write a prescription to produce the desired result. Research focuses on control include testing interventions to improve the health status of individuals, families, and communities, testing interventions to improve healthcare delivery, synthesis of research for their development into EBP guidelines, and testing the effectiveness of EBP guidelines in clinical agencies. For example, using the evidence-based knowledge for the administration IM injection helps control the achievement of the following outcomes in practice. First, adequate administration of medication to promote patient health. 2. Minimal patient discomfort. And 3. No physical damage to the patient. Okay, let's talk about the historical development of nursing research. Nightingale is the first nurse researcher, with her initial studies focused on the importance of a health environment in promoting patient physical and mental well-being. Nightingale is also noted for her data collection and statistical analysis. Nightingale's research enabled her to instigate attitudinal, organizational, and social changes. First, she changes the attitude of the military and society about the care of the sick. Nightingale improved the organization of army administration, hospital management, and hospital construction. Because of Nightingale's research evidence and influence, society began to accept responsibility for testing public order, improving sanitation, preventing starvation, and decreasing morbidity and mortality rates. The second phase is 1900s through 1970s. The American Journal of Nursing was first published in 1900. Nursing educational opportunities expanded, with Teachers College at Columbia University offering the first educational doctorate program for nurses in 1923, and Yale University offering the first master's degree in nursing in 1929. In the 1950s and 1960s, nursing schools began introducing research and the steps of the research process at the baccalaureate level. In the 1960s, an increasing number of clinical studies focused on quality care and the development of criteria to measure patient outcomes. In the late 1960s and 1970s, nurses were involved in the development of models, conceptual frameworks, and theories to guide nursing practice. The communication of research findings was a major issue in the 1970s. The conduct of clinical research was the focus of the 1980s, and clinical journals began publishing more studies. Qualitative research was introduced in the late 1970s, and the first studies appeared in nursing journal in the 1980s. Another priority of the 1980s was to obtain increased funding of nursing research. Outcome research emerged as an important methodology for documenting the effectiveness of healthcare services in the 1980s and 1990s. Building on the process of research utilization, physicians, nurses, and other healthcare professionals focused on the development of EBP for healthcare during the 1990s. The emphasis on evidence-based practice in nursing resulted in more biological studies and randomized controlled trials being conducted. Nursing research in the 21st century, Quality studies using a variety of methodologies, synthesizing the study findings into the best research evidence, and using this research evidence to guide practice. ABP has become a stronger focus in nursing and healthcare agencies. The focus of healthcare research and funding has expanded from the treatment of illness to include health promotion and illness prevention. Okay, let's talk about the acquiring knowledge in nursing. Acquiring knowledge in nursing is essential for delivery of quality, safe patient and family nursing care. Knowledge is essential information acquired in a variety of ways that is expected to be an accurate reflection of reality and is incorporated and used to direct a person's action. The quality of nursing practice depends on the quality of knowledge that you acquired. Nursing has historically acquired knowledge through tradition, authority, borrowing, trial and error, personal experience, role modeling, intuition, and reasoning. Okay, the first is traditions. Traditions include truths or belief based on costumes and trends. For example, some of the policy and procedure manuals in hospitals contains traditional ideas. The second one is authority. An authority is a person with expertise and power who is able to influence opinion and behavior. Knowledge acquired from an authority is illustrated when one person credits another as the source of information. Borrowing involves the appropriation and use of knowledge from other fields or disciplines to guide nursing practice. For example, some nurses have used the medical model to guide their nursing practice, thus focusing on the diagnosis and treatment of disease. Also, other nurses often borrow knowledge from other disciplines such as psychology and sociology, but integrated this knowledge in their holistic care of patients and families experiencing acute and chronic illnesses. Next is trial and error. Trial and error is an approach with unknown outcomes that is used in a situation of uncertainty in which other sources of knowledge are unavailable. This method can be time consuming because you may implement multiple interventions before finding one that is effective. There also is a risk of implementing nursing actions that are detrimental to patient health. If studies are conducted on nursing interventions, selection and implementation of interventions need to be based on scientific knowledge rather than on trial and error. Next one is personal experience. Personal experience involves gaining knowledge by being personally involved in an event, situation, or circumstance. The example of personal experience is the theory of from novice to expert by banner. Role modeling is learning by imitating the behaviors of an expert. An intense form of the role modeling is mentorship, in which the expert nurse serves as a teacher, sponsor, guide, and counselor for the novice nurse. Intuition is an insight into or understanding of a situation or event as a whole that usually cannot be explained logically. Because intuition cannot easily be explained scientifically, many people are uncomfortable with it. But some nurses can intuitively recognize when a patient is experiencing a health crisis. The final way is reasoning. Reasoning is the processing and organizing of ideas to reach conclusions. The science of logic includes inductive and deductive reasoning. Inductive reasoning moves from the specific to the general, and deductive reasoning moves from the general to the specific or from a general premise to a particular situation or conclusion. Acquiring knowledge through traditions, authority, borrowing, trial and error, personal experience, role modeling, intuition, and reasoning is an important in nursing. However, these ways of acquiring knowledge are inadequate in providing an EBP. Thus, a variety of research methods are needed to generate the knowledge. So this section introduces quantitative, qualitative, and outcomes research methods that are used to generate empirical knowledge for nursing practice. You can see the characteristics of three research methods in detail. First, quantitative research is a formal, objective, systematic process in which numerical data are used to obtain information about the world. The philosophical origin is logical positivism. Quantitative researchers hold the position that truth is absolute and that a single reality can be defined by careful measurement. Qualitative research is a systematic, subjective approach used to describe life experiences and situations and give them meaning. Qualitative researchers believe that truth is complex and dynamic and can be found only by studying people as they interact with and in their social historical settings. Finally, outcomes research focuses on examining the result of care and determining the changes in health status for the patient. Nurses are playing an active role in conducting outcomes research by participating in multidisciplinary research teams that examine outcomes of healthcare services. The quantitative research could be divided into four designs. The first one is descriptive research design. Descriptive research explores new area of research, describes situations as they exist in the world, and tests theory by describing variables. Second one is correlational research. It examines relationships and is conducted to develop and refine exploratory knowledge for nursing practice. Quasi-experimental and experimental studies determine the effectiveness of nursing interventions in predicting and controlling the outcomes desired for patients and families. The qualitative research method are phenomenological, grounded theory, ethnography, exploratory descriptive qualitative research, and historical research. Phenomenological research is an inductive descriptive approach used to describe an experience as it is lived by an individual, such as the lived experience of chronic pain. Grounded theory research is an inductive research technique used to formulate, test, and refine a theory about a particular phenomenon. Ethnographic research investigates cultures through an in-depth study of the members of the culture. Next one is exploratory descriptive qualitative research. It is conducted to address an issue or problem in need of a solution and understanding. Finally, historical research is a narrative description or analysis of events that occurred in the remote and recent past. Best research evidence was previously defined as a summary of the highest quality current empirical knowledge in a specific area of healthcare that has been developed from a synthesis of quality studies in that area. We're going to talk about the strategies used to synthesize the research evidence. Research evidence in nursing and healthcare is synthesized by using the following processes: systematic review, meta-analysis, meta-synthesis, and mixed method systematic review. Depending on the quantity and strength of research findings available, nurses and healthcare professionals use one or more of these for synthesis processes. The first one is a systematic review. A systematic review is a structured, comprehensive synthesis of the research literature to determine the best research evidence available to address a healthcare question. A systematic review involves identifying, locating, appraising, and synthesizing quality research evidence for expert clinicians to use to promote an EBP. Systematic reviews are also used in the development of national and international guidelines for managing health problems such as acute pain, hypertension, and depression. The second one is meta-analysis. Meta-analysis is conducted to combine or pull the result from previously quantitative studies into a single statistical analysis that provides one of the highest level of evidence of an intervention's effectiveness. Qualitative studies do not produce statistical findings and cannot be included in a meta-analysis. Some of the strongest evidence for using an intervention in practice is generated from a meta-analysis of multiple controlled quasi-experimental and experimental studies. Meta-synthesis is defined as the systematic compilation and integration of a qualitative study result to expand the understanding and develop a unique interpretation of a study findings in a selected area. The focus is on interpretation rather than on combining study results, as with qualitative research synthesis. Last one is mixed method systematic review. Mixed method systematic review synthesis of findings from individual studies conducted with a variety of methods, including quantitative, qualitative, and mixed method, to determine the current knowledge in an area. Some researchers have conducted the synthesis of quantitative and qualitative studies termed integrated review of research. The strength of validity of the best research evidence in an area depends on the quality and quantity of the studies that have been conducted in an area. Quantitative researches, especially experimental studies such as the RCT is a randomized controlled trial, provide the strongest research evidence. Also, the replication or repeating of studies with similar methodology increases the strength of the research evidence generated. The systematic review and meta-analysis of high-quality experimental studies provide the strongest or best research evidence for use by expert clinicians in practice. Correlational, descriptive, and qualitative studies like this often provide initial knowledge, which serves as a basis for generating quasi-experimental and outcomes studies. The weakest evidence comes from expert opinions, which can include expert clinicians' opinions or the opinions expressed in committee reports. Evidence-based guidelines are rigorous, explicit clinical guidelines that have been developed based on the best research evidence available in that area. Every year, new guidelines are developed, and some of the existing guidelines are revised based on the new research evidence. These guidelines have become the gold standard. When selecting a guideline for practice, be sure that the guideline was developed by a credible agency or organization and that the reference list reflects the synthesis of extensive number of studies. As the last part of this lecture, I'm going to talk about your role in nursing research. Whatever their education or position, all nurses have roles in research. Some ideas about those roles are presented in this figure. Nurses with Bachelor of Science in Nursing, called BSN, are knowledgeable about the research process and have skills in reading and critically appraising studies. And nurses with a Master of Science in Nursing, called MSN like you, have the educational preparation to appraise critically and synthesizing findings from studies to revised or developed protocol, algorithm, or policy for use in practice. The doctorate in nursing can be practice-focused, called DMP, or research-focused, called PhD. DMP are educated to have the highest level of clinical expertise with the ability to translate scientific knowledge for use in practice. PhD prepared nurses assume a major role in the conduct of research and generation of nursing knowledge in a selected area of interest. Finally, postdoctorate prepared nurse usually assume a full-time research role and has a funded program of research. Today, we learned about introduction of nursing research and evidence-based practice. If you have questions, please feel free to contact me. Thank you very much.